Caravan to Midnight. I'm Dr. Dave Janda. It is an honor to be working with the iconic John B. Wells and to be a member of the Caravan to Midnight family. You know, folks, as a quick reminder, in addition to my role here at the Caravan to Midnight, I also host a Sunday show, Operation Freedom, which airs out of the People's Republic of Ann Arbor, Michigan, from our Freedom Bunker at Wham Talk 1600 Studios. It airs every Sunday from 2 to 5 Eastern. Please join us. It's a live show. You can call in, be part of the show. We focus on bringing guests and information the bought-off, lamestream, fake media will never provide. So join us every Sunday. But if you miss the show from 2 to 5 Eastern, and you can stream the show live at davejanda.com, you can go back to davejanda.com because usually we have the podcast available for you at about 9 p.m. Sunday. Hopefully you'll download the podcast and you'll network that information as you will with our Caravan to Midnight segments and John B. Wells segments as well to anyone and everyone you know. You see, the key, folks, is educating, empowering, and then having you take that information and networking it to your family, your friends, your neighbors, your acquaintances. The more people we have educated on the facts, not the propaganda spewed by the lamestream fake media, but the facts, the sooner we wrestle back control of our country, our society, from the globalists who want to strip us of our freedoms and our liberties and ultimately our lives. Now, many people say when I get to the lives part, wow, that's hyperbole. That's an overstatement. I don't think so. Why do I say that? When the globalist puppet, and understand, I believe the Bushes, the Clintons are also globalist puppets. But the first thing the globalists did when they got their puppet Obama anointed president of the United States, the first thing they did is they went after our healthcare delivery system. You see, I was told by folks on the inside in Washington that this would be the case before he was inaugurated. And as they told me, look, Dave, if you get control of people's health and healthcare delivery, you control every business, every family, and every person. Because you not only control how they live, but you can control how they die. You see, folks, Obamacare was a huge piece of legislation, just if you look at it physically. Supposedly it was a piece of legislation that was crafted over a month's time. BS. That was years in the making. In fact, they even had a trial run of Obamacare. The same people that were involved in the writing and implementation of Obamacare previously were involved in the writing and implementation of something called Romneycare. You see, when Romney introduced Romneycare in Massachusetts, I put up my hand and threw a red flag. Said, wait a minute. You're stripping people of their healthcare freedom. This is actually going to be a disaster. I was chastised by the Republican blue bloods, even people that consider themselves conservatives, chastised me that I wasn't a team player, that I shouldn't be so critical. In fact, my criticisms of Romneycare came to fruition. And in fact, it was a disaster for patients and for providers. But that didn't stop them. Even though Romneycare imploded, they still used the same formula to create Obamacare. And the reason is Obamacare was crafted to essentially implode, just like Romneycare. Because Obamacare, and I know this sounds sinister, but it's actually true. Obamacare was written to fail and to usher in a single-payer system, which was always the goal of the globalists. Why? Because they would have more control and more power with a single-payer system. Now, right now, President Trump has stated that we need healthcare reform. We need to get rid of Obamacare. I agree. I support him on that. But I got in trouble with the Trump administration because I didn't support Ryan Care, which has now become Trump Care. And it passed the House, and now it's with the Senate. And I have gotten in further trouble with the establishment because I'm not willing to support it. And here's why. Because Obamacare, when it was written in two parts. That's right, two parts. 99% of our population do not know that. The first part was hidden in the stimulus bill and passed into law in February of 2009. The second part was the health care bill, the so-called Obamacare bill that was passed into law in March of 2010. When you add both parts up, it was my feeling at the time, and I believe has actually been shown to be correct, that Obamacare would make healthcare delivery unavailable, unaffordable, and adversely affect the quality of care being delivered. Now, I think it's critical that you understand the nuances of Obamacare, because here is the reason why. In the current legislation with Ryan Care or Trump Care or whatever you want to call it, they don't get rid of Obamacare. They tweak it. You see, what I've told people on Capitol Hill is Obamacare is cancer. I told these members of the House and Senate, if you came to me as a patient and you had cancer, would you want me to tweak your cancer? Or would you like me to rid your body of it, to dissect it, to extract it, to get rid of it? You see, folks, Obamacare is cancer because it takes control of your healthcare life. And it puts your healthcare life in the hands of not just insurance executives, but political bureaucrats, all of whom have no functional medical knowledge. What we need to do is we need to reestablish the doctor-patient relationship. We need to bring healthcare more to a local level rather than a central level. But the globalists want it to be at a central level. You know, when I first started speaking about this in 2009, about the harms of Obamacare, the initial reaction of the Obama zealots was, Janda, you're saying all these things anti-Obamacare because you're a racist. No, I'm a realist. And the reality of the situation is all you had to do was read Obamacare, which I did. It was going to make healthcare less available, less affordable, and less quality oriented. Now, folks, you know, as far as the racist part, I'm a surgeon by trade. I was a surgeon for 32 years. And I can tell you something, one fact. I don't know of anyone who ever walked in an operating room that was a racist. And the reason is because when you make that incision on someone's skin, no matter what race they are, no matter what religion they are, when you get through the first 2 millimeters, and I've said this before on Caravan, we're all pink. No, I wasn't a racist. I was a realist that had the courage to step up and tell the truth of what Obamacare was really all about. But they haven't stopped using that line. You know, recently the United Nations came out, and I'm not sure what the United Nations is doing, weighing in on our domestic situation, our domestic policies, but of course they're a globalist organization, so why not? The UN said to Trump, quote, Obamacare repeal would violate international law. I'm not sure how. And they also went on, quote, it would also be racist to repeal Obamacare. Here we go again. You see, when all else fails, the globalists throw the race card. And they also love to throw the victim card, as we've spoken of before. What I want to do, folks, is I want to show you what Obamacare is really all about. Because I want to impress upon you the fact that any reform plan that does not get rid of the cancer of Obamacare is going to fail. That it's going to continue to implode the healthcare delivery system and impede your healthcare freedom. It has to be ripped out by the roots completely if we are to make healthcare more available, affordable, and quality-oriented. Now, people say, Obamacare, well, Obamacare provided 20 million Americans with insurance. No, it didn't. That's bogus. That's fake. That's propaganda from the lamestream fake media. First concept we all have to realize. Having health insurance does not mean that you will get health care delivery. I said this from the very beginning with Obamacare. I go, it's going to be too expensive. The deductibles, the co-pays are going to be so high. People won't be able to afford it. They might have a policy that they can barely afford, but they can't pay for the co-pays and deductibles. They'll never use it. What difference does it make if they have some piece of paper that says they have insurance that they paid 3 times the amount they would have before Obamacare went into place? And in fact, I was proven to be correct. Patient after patient that had come to see me would say, yeah, I realize that I need to have this operation because I can't lift my arm any longer and I have my rotator cuff torn. But my copay and deductible is so high, I have to wait till my kids and my wife all are sick so that, we get to our deductible so that I can then use this piece of paper, this insurance policy, to get treated. And look at that 20 million figure. Of the 20 million people that supposedly got Obamacare, when Obamacare went into place, 8 million people lost their insurance. So the 20 million that got it, 8 lost it to begin with, so really that brings that number down to 12 million. And of the 12 million, 11 million people were shoved onto Medicaid, which is government insurance for the poor and indigent. Now let me tell you something. Anyone who's been on Medicaid will tell you it's not a good insurance program. Why? Because very few physicians accept Medicaid. Why? Because you lose money on every patient you take care of. You can't stay in business if you take care of solely Medicaid patients. But there are 4 studies, peer-reviewed studies, that you're unaware of that the media will never tell you about. And all 4 of these studies from prestigious institutions show that people on Medicaid have poor healthcare outcomes and a higher chance of dying than people that have no insurance at all. What? That's right. And the reason is because Medicaid is a ration-based program. It rations medications, treatments, testing. And that's why folks on Medicaid have poorer health care outcomes and a higher chance of dying than folks that have no insurance at all. So 12 million people essentially received health insurance, or a piece of paper, not that they got health care delivery, but a piece of paper. And of those 12 million, 11 were on Medicaid. Are you aware that more people paid a fine not to have Obamacare than got Obamacare? Yeah. 12.7 million people paid whatever Judas Roberts wants to call it, a tax, a fine, a penalty, not to have Obamacare. Do you ever hear the mainstream fake media talk about that or address that? No, of course not. It's not part of the propaganda narrative. Let me take you through a couple points as it relates to Obamacare, because I think this is really important and stuff you're not going to get from the bought-off lamestream fake media. Look, as I mentioned, Obamacare is 2 parts. First part was hidden in the stimulus bill. In the stimulus bill, there are rationing boards and enforcement boards that were hidden in that stimulus bill. The rationing board was entitled the Federal Coordinating Council for Comparative Effectiveness Research. How do I know that's a rationing board? Because of the words comparative effectiveness, and we'll get in that in a minute. The enforcement board to enforce the rationing protocols was called the Office for the National Coordinator of Health Information Technology. How do we know that's an enforcement board? Because of what was written in the stimulus bill, which we'll get to in a second. So look, let's go back to the rationing board. Comparative effectiveness. The definition of comparative effectiveness, now listen now, this is a rationing formula based on cost and age. It's the approval or rejection of a treatment or a test based on two things. The cost of the treatment divided by the number of years the patient will benefit. That is a rationing formula. Now look, any system that focuses on the rationing of healthcare delivery, not by the patient and doctor talking or the family being involved, but by a formula created by government bureaucrats with no functional medical knowledge that are thousands of miles away from where that patient's being treated, is the most unethical and inhumane means of cutting cost, period. Anyone who tells you anything different, if they're a doc, don't go to them. If they're any kind of provider, don't go to them. Run really fast away from them. This is a rationing formula. It's actually a rationing formula that was very similar to a formula that was in Hillary Care when I analyzed that for Senator Bob Dole back in 1992. It's a similar formula that's used in the British healthcare system. It's sinister. Now let's go to the enforcement board. The National Coordinator's Office, it says in the stimulus bill, will, quote, guide medical decisions at the time and place of care, end quote. Wait, the doctor-patient isn't determining that, or the family? It's the National Coordinator's Office? Bing, 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 red flags. That's a huge problem. That will, quote, guide medical decisions at the time and place of care? A bureaucrat hundreds if not thousands of miles away? It also went on to say that this coordinator's office will be responsible for monitoring treatments to ensure that providers and hospitals are following government protocols. That's the rationing formula that we talked about from that Federal Coordinating Council. It went on to say, this enforcement board, that hospitals and providers that are, quote, not meaningful users of the system will face penalties. And that the Secretary of Health and Human Services can impose more stringent measures of meaningful use over time. Now, what does all that gobbledygook mean? What that gobbledygook means is that if your doctor doesn't go along with the rationing formulas, they will be fined. And according to members of Congress, and I mentioned this in a previous presentation on the Caravan site, when I went to Washington, was a keynote speaker at a congressional dinner, and I put that slide up in front of the congressman, and what does this mean? I said, does that mean I'm going to get paid $30 to see that patient, be fined $100? Congressman stood up and said, no, Dr. Janda, you could be fined on your first offense up to $100,000. And if you have a second offense, you, quote, could go to jail, end quote. How do you work in that kind of system? You can't. And that's why thousands of doctors have retired prematurely in the past year. And I'm one of them. I retired January 1st, 2017. Because I believe if I participated in that kind of system, I would be violating the oath I took when I became a physician back in 1984 at Northwestern University Medical School. You see, folks, the core, the heart of Obamacare is to ration and deny care. It creates that Federal Coordinating Council for Comparative Effectiveness Research. It then, in the healthcare bill, the second part, created a multi-billion-dollar center to oversee this rationing. And to those people that say, well, you know, I still think that care won't be rationed, really, because just look at Obama's own numbers. If you're going to bring 20 million new people into the system, which I believe is bogus, and you have the same number of providers, how do you not ration care? But it gets worse, because there are studies that show that over the next 3 to 5 years, there are going to be 46% fewer providers of healthcare delivery in this country because of retirement, premature retirement, and the like. So you have 20 million new people, or even 1 million, or even if it stays the same. And 46% fewer providers, how do you not ration care? But in addition to pay for Obamacare, Obama ended up, and Congress ended up cutting Medicare by $500 billion over 10 years. Now, Medicare is the government insurance program for seniors, senior citizens. Over the next 10 years, there's going to be, because of our population, there's going to be 30% more seniors in Medicare. If there are going to be 30% more seniors and $500 billion, how do you not ration care? No, it's sinister. And initially when they came up with this figure and they said, oh, okay, well, it's going to cost about $1.2 trillion. Wrong. The latest figure is Obamacare cost $2.3 trillion. Oh, they were only off by 50%. A trillion here, a trillion there. One of the huge problems in healthcare is the administration side of the program. In that, from when I started practicing in my practice in 1989, after I finished my residency and fellowship, and when I retired in January 1st, 2017, I had my office manager do an analysis. I said, not looking at inflation-related dollars, what did I get paid for particular operations in 89 and what did I get in 2017? She came back to me and she said, look, she said, when I look at your preoperative charges, surgery charges, and 3 months of postoperative care in 1989 compared to 2017, your pay per procedure went down by 50%, 50%. So then you're asking, and rightfully so, wait a minute. My insurance premiums have gone up hundreds and hundreds of percent since then. If Janda is getting hit by 50%, where's this money going? And here's what she then told me. And she said, then I looked at the administration costs associated between 1989 and 2017, and administration costs have gone up 1,100%, and that's the reason why. So what did Obamacare do? Did Obamacare reduce the number of federal agencies? No, you guessed it. It increased the number of federal agencies, administrators, 159 new federal agencies. It created a health insurance exchange that when they used this for the federal government before Obamacare for federal employees called the Federal Benefit Employee Health Program, the Government Accountability Office concluded, quote, that this exchange was, quote, highly vulnerable to fraud and abuse. Yet it's a key component of Obamacare. I mean, who could have predicted that would implode? Obamacare established a comprehensive database on Americans so that part of that meaningful use was that physicians starting this year, have to turn over your medical records to the government, and the government can have 24/7 access. Folks, back in the early 90s, they passed a law called HIPAA, which is for patient confidentiality, where as a physician, I was liable for your records, that nobody got a hold of them. Okay, good. Now, prior to that, 30 years that our practice was in business, long before I got there, they never had a breach of a data problem or of a patient confidentiality problem. But this law went into effect. But now, essentially, HIPAA gets thrown out the window, right? And your records automatically are at the discretion of some government snoop looking around when it's none of their business. Obamacare also established the individual and employer mandates, and gratefully, in both the House bill and now the Senate bill, those are going away. You know, it's interesting with those mandates. Everybody said, well, this will make the program more viable. Really, because the chair of Obama's own Council of Economic Advisors stated that the mandates would, quote, lead to a loss of 5.5 million jobs, end quote. She was right. And she wasn't the chairman of the Council of Economic Advisors very long after she stated that. She hit it on the head. And in addition to those loss of 5.5 million jobs, look at how many jobs have become part-time. Because if you're part-time, your employer doesn't have to cover the Obamacare benefits. This has devastated our economy. If you want to know why there are 96 million people that are no longer in the workforce, look at Obamacare. It also hit all of us with $750 billion in new taxes, no matter what Judas Roberts is going to call it. It imposed $136 billion in new taxes on families making less than $250,000. As I mentioned, it cut Medicare to seniors by $500 billion. It increased a Medicare payroll tax by 30%. In both the House and the Senate bill, these taxes are going away. But here's the onerous part. Obamacare funded the IRS an extra $10 billion to hire 16,000 new agents to enforce Obamacare. I haven't seen in the House or the Senate legislation that this $10 billion is being removed. Let's hope it is. You know, when it first came out, the Congressional Budget Office said that 4 million Americans are probably going to have to pay a fine for not having a government plan. Well, as I mentioned earlier, they were off by a factor of a couple 100% because it ended up 12.7 million Americans paid a fine not to have Obamacare. You know, prior to passage of Obamacare, and they deep-sixed this so that the public would not know, the Department of Health and Human Services did an analysis, and they concluded that actually Obamacare would increase cost. It would increase cost by at least $300 billion over 10 years. And that the cuts in Medicare alone, the $500 billion, would lead to about 15% of hospitals and nursing homes to close. And we've already seen that. You see, folks, from the very beginning, it was evident that Obamacare would fail. Yet Obama kept saying, you'll keep your plan, you'll keep your doctor. And we all know that was a repetitive lie. In fact, prior to passage, the U.S. Chamber of Commerce said 66% of small businesses and 50% of large businesses would need to change their insurance coverage for their employees. And in fact, that happened. You see, folks, the bottom line is Obamacare does not make healthcare more available, more affordable, or more quality-oriented. But what it does do, it takes control of your life and every American's life. It's important that you know these facts. And the reason is because as this debate goes on about, well, we're going to institute a new healthcare reform package. But any package that tweaks Obamacare and doesn't rip it out by its roots is doomed to failure. I'm very concerned. I did not support Ryan Care for that reason. It left the infrastructure of Obamacare in place. I completely disagree with that. I believe that you got to rip it out by its roots. You got to rip it out by its roots immediately. So the question is why wasn't it ripped out by its roots? No matter what anyone tells you, Obamacare benefited the insurance industry. Obamacare, just as Romney Care, was written by the insurance industry. You see, I believe it was written to fail. And the insurance companies all got together, they love to collude, and said, look, we want to really be out of the insurance business, but we're really into the money business, so let's just stick with the administration side. So with Obamacare, as it would fail and go to a single-payer system, insurance companies had already divided up the country of which parts of the country they would administer. Aetna, you get this part. Humana, you get this part. Blue Cross Blue Shield, you get this part. Just to name a couple. And they would get huge, huge fees for administering, but they would be out of the, essentially out of the liability business, and the government would accept that. Not the government, you, the taxpayer, would accept that. I was concerned when I read RyanCare that left so much of Obamacare in place that costs would continue to increase, availability would continue to diminish, the quality would continue to diminish. And I actually felt that a good part of RyanCare, or now TrumpCare, was written by the insurance industry. I talked about this on Operation Freedom, and I want to read to you a response I got from a listener. This is a listener who actually works in the insurance industry. Was RyanCare legislated by the insurance companies? Yep. I work for one of the big insurance companies, a household name, and yes, I'm deeply conflicted by that fact, even though my direct role has nothing to do with insurance. That said, we get updates from leadership through various communications all the time. Our CEO actually had the audacity to send out a self-congratulatory internal communication 2 weeks ahead of the RyanCare vote, telling the company that he had just been in Washington with several other insurance company leaders meeting with Trump and his team. It was written in corporate speak, but in no uncertain terms for anyone who can read between the lines. He emphasized how excited he was for the company's future performance should RyanCare pass, which he fully expected, and stressed how positive the meetings were with Team Trump and the legislative members on Capitol Hill. His tone was, quote, "Don't worry, we're all over this," end quote. Nudge, nudge, hint, hint. He was being so obvious that they were behind it. I could only shake my head after reading it. You see, folks, the bottom line is we need healthcare reform that empowers you. Health savings accounts, direct primary care to be focused and utilized, prevention and wellness initiatives, high-risk pools to cover those with pre-existing conditions that can be handled through every state. Heck, prior to Obamacare, we had 35 states doing it. All we needed were 15 more. That's easily done. We need to have insurance companies compete and not collude and sell across state lines. We need to let small businesses pool to buy insurance to get better rates for their employees and for their businesses. You know, it's been said, well, this can't happen overnight. One of the guests I have on my show, who's a healthcare policy analyst, who is tied actually on a frontline basis, not to the big boys in the insurance industry, but to people on the insurance side. He's devised a plan, David Powell from Kansas, that with what we just spoke about, could eliminate Obamacare overnight. Quick transition period within 24 hours. And it would cut your premium between 60 and 70%. It's doable. The press won't tell you that. The lamestream fake media won't tell you that. The politicians won't tell you that. And they won't tell you that because who loses with that type of approach are the big fat cat insurance company executives. And they pour billions of dollars in the pockets of all the politicians collectively in Washington, and millions in each politician in Washington. The only way we get to the right solution is you need to contact your elected representatives and tell them you're wise to the situation, and if they don't do the right thing, and here is the right thing that we just spelled out, get rid of Obamacare. Free market reforms, health savings accounts, direct primary care, prevention and wellness initiatives, have insurance companies compete, high-risk pools, an emphasis on direct primary care. There you go. And if they don't do that, you and your neighbors will make sure that they don't even make it through the primary, that they are primaried out. That is the only thing they listen to. This is not a spectator sport. Folks, it's time to get off a dead center. It's time to inform the elite that you're wise to them. And if they don't do the right thing, they're going to be voted out.